The wilderness is beautiful until it turns on you. One misstep, a fall, and suddenly you're staring at a serious injury. Blood pouring, bone exposed, pain blinding. Out here there's no help coming, it's just you, your injury, and the wild. Panic is natural, but it's deadly. Every second counts. Blood, warmth, and hope are slipping away. This is the test. Do you freeze or do you fight? Survival isn't about strength. It's about refusing to quit and thinking clearly when everything falls apart. The golden hour for trauma care. In the wild, it's the golden minute. You are the first responder, the medic, and the patient. The wild doesn't care about your plans, it demands action. Take a breath, push down the panic, see the injury as a problem to solve. This mindset shift is your first step to survival. You must become your own rescuer. The skills and gear you carry are now your lifeline. The wild has thrown down the gauntlet. Rise to meet it, not with hope, but with a plan. Your life depends on what you do next. This is the crucible where survivors are made. Act, adapt, overcome. The wild bites back, but you bite back harder. What do a soldier and a stranded hiker have in common? Everything that matters. Both face trauma far from help, with only seconds to act. Battlefield medicine is built for chaos. Its lessons save lives in the wild. The key: delayed evacuation. You might wait hours or days for rescue. Immediate care is everything. Combat medics learn to stop what kills fastest, massive bleeding, before anything else. In trauma, priorities change. Blood loss, shock, and hypothermia are your enemies. Adopt the mindset of a warrior. You're not just a victim, you're your own best chance. Survival means thinking like a medic and acting like one. Forget the old ABCs. In trauma, follow March. Massive hemorrhage, airway, respirations, circulation, hypothermia. First, stop massive bleeding. Nothing else matters if you bleed out in minutes. Use a tourniquet, high, tight, and fast. Don't hesitate. Once bleeding is controlled, check the airway. Make sure it's open. Tilt the head, lift the chin, or roll to the side. Next, check breathing. Look for chest rise. If there's a chest wound, seal it. Then, address circulation. Treat for shock, control lesser bleeding, keep the person calm and lying down. Finally, fight hypothermia. Blood loss makes you cold fast. Insulate immediately. March brings order to chaos. It's a combat-tested protocol that saves lives in the wild. Remember, act in order, don't get distracted. Your priorities are now clear. March is your survival checklist. Use it. Knowing March is one thing. Doing it is another. For bleeding, use direct pressure, wound packing, or a tourniquet. Pack deep wounds with gauze or cloth, then press hard. Clean wounds with the cleanest water you have, cover with sterile dressing, and protect from dirt. For broken bones, immobilize with a splint, sticks, trekking poles, whatever's rigid. Secure above and below the break. Keep the injured person warm, off the ground, wrapped in layers and hydrated, if possible. Hypothermia is a killer, even in mild weather. Every action buys time. These skills are brutal, but they save lives. In the wild, you are your own medic. Practice now, so you're ready when it counts. Gear matters, but only if you know how to use it. Your trauma kit should have at least 2 tourniquets, hemostatic gauze, a pressure dressing, trauma shears, gloves, and an emergency blanket. But gear is useless without training. Take a stop the bleed or wilderness first responder course. Practice until it's muscle memory. These techniques are for true emergencies. Improper use can harm. Always seek real training. Survival is preparation meeting opportunity. When crisis hits, you fall back on your training, not luck. Stay calm, act decisively, and you'll turn a disaster into a story of survival.